Across sections of stakeholders in the fight against tuberculosis around the world have expressed doubt on the possibility of Nigeria to achieve the target of ending tuberculosis by the year 2030. The stakeholders disclosed this during a Zoom meeting and a media roundtable with the title "Joining to End TB by 2030. How far are we?" The guest speakers noted that if Nigeria will achieve the target, that there is a need for increased funding, mobilizing of adequate domestic resources towards the fight against the disease. They, however, expressed optimism that Nigeria may achieve the feat in the year 2035 if adequate measures are taken towards ending the pandemic.
Do prevention activities at scale. We have some current tools that can be used. For example, we have TB preventive therapy for certain groups of people. There are recommendations. But also, to end TB, we will need ultimately a vaccine. The global plan actually calls for development, actually fast-tracking the current development of vaccines that are happening for TB. And to have at least one new vaccine, maybe more, by 2025, that can be used by countries to vaccinate people, and that will have a final push towards ending TB. Many other things have to be done for ending TB, which the global plan puts it as enablers, and these are things that will help to make progress in this area. Things such as the engagement with community-led actions, rights, gender, stigma, many other enabling things that will assist the diagnosis.
The summary of what is expected at that, is that it's shown that by 2020 should be 35% coverage for reduction in number of TB cases as compared to 2015. And that to 2030, which is by 90% for a reduction in number of TB deaths, reduction in TB incidence to 80%, and percentage of TB patients and their household experiencing catastrophic costs is expected to be reduced to 0.
Also speaking, the National Coordinator, National Tuberculosis and Leprosy Control Program, Federal Ministry of Health, Chukwuma Anyaike, observed that Nigeria has recorded 85% success in the treatment of adults and children in the country.
What are the progress that we have made as a country towards those targets? Are we declining in incidence? Have we reached a stage where the incidence of TB is declining? Have we reached a stage where the death in TB has declined? And looking at this has been shown that in the last 5 years, the country has increased in TB cases, and like it was shown in the last slide, between 2020 and 2021, we had the highest increase of about more than 7,000 cases increase between those 2 years. And in 2021, we recorded a 207,785 cases. So this is about 50% increase when you compare to what we recorded in 2020. So the country actually has made progress in the last 3, 4, 5 years.
As part of measures to end TB in Nigeria, media organizations have been urged to sustain a massive awareness creation on tuberculosis, mostly in the rural communities. Basil Okafor, Core TV News.